South Korea has gone its own way in the fight against the coronavirus. Testing was core to its strategy at the start of the pandemic. People used masks in private homes. An app closely monitored the population, enabling authorities to track infection chains. The vaccination campaign also quickly picked up speed. Now, over 40 million people in South Korea have received at least one jab. That means over 80% of the population is fully or partially immunized, among the highest vaccination rates in the world. But has South Korea done everything right? And what can other countries learn?
Welcome, I'm Ben Fazulin. Is it time to learn to just live with COVID? That's what South Korean officials are saying. Experts around the world view the nation as a role model in its handling of the crisis. Let's take a closer look.
It's a big moment for manager Lim Jong-man. He's opening this daytime disco in Seoul for the first time in 6 months. It comes as the government loosens many of the restrictions imposed because of the pandemic. Like the patrons, the owner is happy, but also nervous. I couldn't sleep well last night. I was worried, but also I was excited because I can run the business again. What I'm worried about is what if I have to close again with more confirmed cases? But the authorities are taking steps to prevent their new plan to live with COVID from leading to a new spike in infections. For high-risk venues like bars and clubs, visitors have to show proof of vaccination or a negative test. And while curbs on opening times for cafes and restaurants will be dropped, there will be limits on the number of unvaccinated people allowed into such places. The authorities hope this will mark a new beginning for the country. We're taking the first step today to return to the path of everyday life. And it's a path we've never been on. The moves to lift restrictions are possible because more than 3/4 of the population in South Korea are fully vaccinated. But the government stresses that the efforts to contain COVID must continue. People are being asked to keep on wearing masks and to ventilate indoor spaces. In this way, they hope all curbs can be lifted by next February.
Il-Haq Lee lectures in medical law and ethics at Yonsei University. In a report, you wrote the government's strategy, K-quarantine, flattened the epidemic curve without a complete lockdown, gaining attention worldwide. But you said the country had to pay dearly. Can you tell us more about that?
Yes, the government did not completely ban the whole society, but actually it equals to the complete ban because the shops has to close at 9 o'clock and the schools are run 1/3 or half, and the younger generation lost their chance to get a job. So people suffered for the lessening of the chance to their free lives. So that's what happened in Korea.
So practically it was a complete lockdown, but a lot of people were taking it upon themselves to take on that responsibility. What I'd like to know from you is if the government is, in return, supporting them financially.
But the compensation was distributed quite late in the year, and it was not the full compensation compared to other European countries like UK or Germany. So the self-employed people got agitated by the fact that they are not completely or fully compensated by the government, even though they cooperate very actively with the government policy.
Well, what's going to happen now? Because a lot of those businesses are saying they can't afford to close again. Is it too early to lift restrictions, or is this the only way to deal with pandemic fatigue? Because health officials say more people are ignoring social distancing rules as this pandemic fatigue sets in?
There was a survey that about 40% of the self-employed person seriously considered close up their shops because due to the loss of incomes and the heavy loans they have to pay. So their agitation and their loss of trust for the government forced the government to lift the ban, or because the government cannot say the saving lives are everything, because we have to restore the society and also we have to deal with the injustice what is inherent in the society.
I so understand where people are coming from, because I've just been taking a look at some of the laws. This cap on unvaccinated people in cafes of up to 4 unvaccinated people in a group doesn't seem to make sense to me. The 100 people who can attend concerts and musicals regardless of vaccination status, and then gyms no longer limiting treadmill speeds because of the worry of all that sweat. I mean, are these the sorts of very specific rules that only cause people to shake their heads, or worse still, not even follow the rules?
Yeah, because the government tried to be very specific for not to fully restrict the society. But in their attempt to not to close the society, the whole society down, but the only possible way is make more complicating laws to deal with it. But the self-employed person and society in general is complaining about the law, the policies, because it looks very unreasonable, and also the application is not fairly applied to each of every people group.
And on top of that, we've got winter coming, we've got Delta around, and cases remain high, although this 80% vaccination rate seems like such a success. Why is that not mirrored in the case numbers?
From the other phases, Korea has taken the aggressive testing and treatment policy. I think this can be one reason of high numbers of the infected person. So far, 16 million have been tested for COVID-19, compared to South Korean population is 48 million. So 1/3 of the Korean population in math have been tested. So the number could be very high. And when I checked the national statistics, about 2/3 of the patients are from Metro Seoul area, which is one of the most densely populated in the world. And also we need to pay attention to the 20s and 30s, who constitute 33% of the confirmed cases. They are most active in their social relationships and the least vaccinated groups. So this could explain the relatively low, the younger generation can explain the relatively low mortality rate, but high the infection rate.
Il-Hak Lee, thank you very much for your insights and interesting talk. Coming to us from South Korea there, the Medical Law and Ethics Division of Yonsei University.
Thank you.
Time for one of your questions now. Here's our science correspondent, Derek Williams.
When will the Novavax vaccine be rolled out?
Novavax is an American biotech firm that has developed a vaccine candidate which produced promising results in large-scale trials. Those results are currently being evaluated by medical authorities in a number of places, including the EU. Last week, Indonesia became the first country to approve the vaccine for emergency use. The company says that it expects other countries to follow suit by the end of the year. Approval in Indonesia, though, alone won't be enough to secure approval from the WHO, which is necessary if the Novavax vaccine is to play a role in the COVAX initiative. There, it could have an especially big impact on the vaccine drive in poorer countries. because of how it's made. The platform is different than that used in vaccines approved so far in Western countries. They're based on information-bearing molecules like messenger RNA, which causes the recipient's body to produce copies of the viral spike protein, which ultimately leads to an immune response against the virus. The Novavax vaccine, however, contains copies of the spike protein itself, which are produced in insect cells, in bioreactors. They draw the attention of the recipient's immune cells, setting a cascade of events in motion that includes the production of antibodies against SARS-CoV-2 spikes and hopefully long-term immune memory of them. One big upside of the platform is that the spike proteins are quite robust, so they don't need to be kept at ultra-low temperatures to remain stable. That makes the vaccine a good potential candidate for distribution in places where cold chain issues are a challenging factor.
And before we go, a quick look at some of the other COVID stories making news. A 20-month US travel ban is over. Fully vaccinated travelers from over 30 countries can now enter the United States. The European Union lifted its restrictions on American travelers back in June. Russians have returned to work after a lockdown to contain the virus ended. The country reported nearly 40,000 new cases on Monday. That's despite the closure of most offices and public places since October 28th. Stay safe and see you again soon.